What do you think the biggest complaint is? I mean, obviously, burnout is something people throw around all the time. Is it people just don't like what they're doing? Is it stress? Is it, the people that they work with? Like, is it always the scenario where they just don't like what they're doing?
No. So a lot of times people just need a different job. Right? Like I've met plenty of people that have just switched hospitals or joined a different clinic and are happy. Right.
Mm,
So it may not be, you may think that it's like you hate emergency medicine or like you hate being a physical therapist or whatever, but maybe you just hate that hospital, that clinic, that way of practicing. Or like what I did is cut down and do other things, right? That might be part of it as well. So it is multifactorial. Sometimes it's just like you're not, you don't feel like you're providing help to anyone. Like you're not helping anybody. You're a paper pusher, or you're just like moving the meat and just trying to make money for someone else. Like that makes people feel terrible. What is career satisfaction? So like feeling like you're helping people is one of them. Being in a job that ignites you is another thing, right? Being able to like go to work and being like happy about going to work is part of it. Having supportive coworkers and supportive boss is another one. So if the people above you, the administration is always just like wanting you to do more with less and never making concessions for your work environment, like that's not helpful. Like autonomy to task, autonomy to your team, etc. Feeling like you have any say, that's a big one. Documentation concerns, like you can go on and on about what the individual is upset most about. Oftentimes it's not the patients that are upsetting to them. It's the work environment or being forced to do too much with too little. So it really depends. Like it depends on what is causing them to be so unhappy. Some people just chose wrong, right? Like they should never have gone to medical school. Maybe it was dad said you had to go to medical school or something, right? And they're just unhappy and they'd be unhappy in medicine, and perhaps a non-clinical career would be better for them. But it really depends on the individual, and we get into that once we start working and trying to figure out like who they are as a person. So um if it's like I want to make $1 million a year and work 9 to 5 and never have call, like I mean, I'm not going to say it's impossible. It's going to take some more work, right?
right.
But if it's, I like commute is killing me and my boss is horrible, then that's probably something we could do something about pretty easily.
Do you have a litmus test or at least something to kind of maybe if someone doesn't know whether like they're stressed with their job, but they don't know whether they hate it because they don't like what they're doing, or perhaps they don't like the place of their working. Is there kind of a discernible difference or something to look for to be like, okay, maybe it's this or maybe it's that?
Well, I mean, I think it comes down to what's important to them. Like if the place is misaligned with their values, will be a big problem. I also take people through an exercise of ideals and deal breakers. So like you want that $1 million 9 to 5 job, right? But what are your deal breakers? Like I got to make 100 grand a year, and I can't work every weekend or something, right? So there's a difference between the deal breakers and the ideals. If your job has like a bunch of your deal breakers, you're never going to be happy. If it's just a couple of things, if it's like, well, it's not my ideal, but it's not hitting any of the deal breakers, then perhaps it's something we can work with. But those rock bottom things, the minimums you need to be happy at work, like those are non-negotiable.